Well, let's get started. So today we're going to be talking a little bit about hip mobility, but in order to really talk about hip mobility effectively, we need to talk about the pelvis as well, because if you think about the hip joint or any joint in your body, no muscle that controls a joint is located just only at that little joint, right? It has to attach above and below it in order for it to actually have like the lever and the force mechanics to be able to actually move it. So that's why we kind of have to talk about the pelvis today. And then for today's agenda, we'll go over some general anatomy of the pelvis and the hip, the effect of the pelvic position on hip mobility, some of the basics, a way to look at your own pelvis and be able to tell whether or not it's kind of shifted slightly out of alignment or not, some releases for your soft tissues around the hip and the pelvis, some of those muscles and fascia, and then also some self-mobilizations for the hip and pelvis. Those are basically focused more at your joints rather than soft tissues. So for the pelvis, the main things that we would be focusing on here that we'll be kind of be palpating, which means feeling with our own hands on our own bodies. If you can see my little laser pointer here, your ASIS, this is that front bony part of your pelvis. If you look at my little camera screen up here, it's generally located around here. I'm sure you can feel that on yourself. Your iliac crest is another big one. Again, if you feel that on yourself, if you put your hands in your sides and push down, it's kind of where that bone blocks your motion from going further down, because that's where your pelvis is. Your ischial tuberosity is your sit bone. So if you're sitting on a firm surface or on the ground and you kind of toggle your weight around, you can really feel where that bone kind of pokes into the ground there. Your acetabulum is your actual, essentially your ball and socket joint of your hip. So this is just kind of showing you the relation of your pelvis and your hip and how they're so very much so interconnected. Over here, this is a half portion of your pelvis. So this is half of your sacrum. You'll hear me talking about the sacrum a lot today. It's generally a triangular shaped bone in between one half of your pelvis and also the other. And then this would be what everybody loves to talk about, your SI joint, your sacroiliac joint. Main things to remember: iliac crest, ASIS. In the back here is your PSIS, your posterior superior iliac spine. We'll also talk about that. And then that's primarily what we'll look over today. So why do my hips always feel tight? I work out, I move around, so I don't understand it. So many people talk about this, but in general, it's important to remember that our soft tissues are what connect all of our bones and joints. Soft tissue can be your muscles, it can be your ligaments, it can be the tendons of your muscles, it can be fascia, which is a non-contractile tissue, but that's what holds your bones in place. So if we think of the example of sitting, if we're sitting for a long period of time, our hips here, these are actually our hip flexor muscles, these guys and these guys. If we're sitting, everything is now bent in an L shape. So if we're standing, everything is straight up and down, and then you sit and your hips flex, right? So all of those hip flexors are now bent at, let's say, roughly 90 degrees when you're sitting. So then your hip flexor muscles are kind of, these guys especially, are squinched into a shorter position. So if you're sitting there for a while you're working or watching TV or commuting or reading, doing whatever you choose to do, those muscles are sitting in a shortened position. So then when you go up to stand, even if you're getting up to stand to go work out, those muscles are used to being shortened for a prolonged period of time. So now first, what you really should do is you should lengthen them out or release them and get them moving to get your pelvis back in a neutral position so that all of your muscles can work, right? So when you first stand up after sitting for a long period of time, these are some of the very common effects of shortened hip flexors. So you can get your lumbar spine, or you can get low back pain, lumbar spine tightness. So, and then hamstring flexibility issues, we'll talk a little bit about that. And then your hip flexion and extension mobility can be limited. So if you note here also, the hip flexors attach pretty high up on your spine. So this is part of your lower thoracic spine, which is your mid-back. Then this is your lumbar spine. So these hip flexor muscles attach at all of them. So if this is contracted here, if you can imagine, if it's shortened, where it attaches, it's gonna pull those bones forward kind of out of the screen towards you, which causes more of an aggressive arching in your low back like this, whereas your back should be slightly arched, nothing excessive. That's where a lot of the back pain comes from. And then also on the other side, note where they attach. They attach on your femur. This is your thigh bone, right? So your hip is in here, hip flexors attach above and below it, right? Okay, so breaking those down a little bit more. So for your lumbar spine, sitting for a long time, hip flexors are shortened. Hip flexors attach above and below. And then what that causes is some reflexive tightening of your low back muscles to stabilize against your hip flexors, pulling those lumbar vertebrae out of the screen towards you. And then your back hurts because your muscles are too tight. Hamstring flexibility issues. So if your pelvis is tilted forward like this, now what happens then is your hamstring attaches to that sit bone that we were talking about, and then also lower on your leg. So if your pelvis is tilted and your sit bone is lifted up towards the ceiling, now your hamstring is pulled into a more taut position across both joints where it, crosses to control motion there at your knee and your hip. So then since that's already pulled taut, and then when you try to bring your leg all the way up into flexion, your range of motion appears to be limited. So the actual length of your muscle isn't really unchanged, but it's just being pulled in longer positions across different parts of the muscle than it usually normally would. So hip extension mobility, same thing, hip flexors, if they're shortened or tight, you can't bring your leg behind you as far because the muscle is just too tight. So, common question, should I just stretch more? So stretching is not the same as releasing your muscle. Stretching kind of brings you to the point of restriction, whereas releasing actually breaks up that restriction, so then you can stretch afterwards into the full length of the muscle, right? So if you think about if you're baking a cake or something and you're mixing the batter and there are all these little clumps in the batter, let's call those the restrictions. And then you smooth out the batter in a pan, before putting it in the oven, but you still have clumps in there. So you still have the restrictions in there because you haven't broken up those restrictions. So really you need to break up the restrictions, and then you might be able to spread your batter further to make it, however thin you want your cake to be, but we need to break up those restrictions. The position of the pelvis affects the length tension relationship of all surrounding muscles and their ability to work. Good pelvic alignment creates good muscular control. And you need balance between strength and mobility to stabilize the pelvis as a foundation for optimal performance and injury prevention. So for the position of the pelvis and affecting the length tension relationship of muscles, what that really means without getting too complicated is muscles need to be able to lengthen and contract and able to function well. So if your bone is tilted and let's say for your hip flexor, if your pelvis is tilted forward and your hip flexor is just in a shortened position, well then it can't lengthen effectively. And we need your muscle to be able to lengthen and contract functionally and efficiently for it to actually be able to work and for you to have strength and balance, right? Again, yes, we are talking about the pelvis. I know you're here to learn about the hip, but it's all very, very much so related. So all of the muscles that stabilize and move the hip attach to either the pelvis or the femur. We have to consider all of these tissues when we're talking about the actual hip joint. And in a structurally normal hip, if you release the surrounding soft tissue restrictions, then the joint will be able to move more freely. And I say structurally normal because sometimes people do have bony deformities that they're born with or that they develop over time with degeneration. And that's normal. Usually these will help with that as well. Same with arthritis. By releasing the soft tissue restrictions, you're actually kind of decompressing the actual joint. So then your joint can move a little bit more freely. And for arthritis, motion is lotion. So that is what we want. It's all about promoting a healthy return of blood flow to the joint and getting some motion restored. So back to the pelvis a little bit, but kind of starting to link the effects of the pelvis and how some of your actual hip muscles work. So on this left side, this is an image of anterior pelvic tilt and kind of the force that is pulled through these different muscles. So these are your back muscles. So those are tightening up, right? Because these are, the front of your lumbar spine is being pulled forward by your hip flexors. So this is your belly button side. So what this causes is a weakness in your glutes because now these are too long, right? See how long this curve is versus this curve. This is like a stretched out rubber band with no elasticity left. It can't actually contract. In your glute complex, all of your glute muscles, it's one of the largest muscle groups of your body. You need those to work. You need them to work to stabilize your pelvis. You need them to work to stabilize walking, single leg activity, really doing anything. Same thing happens with your abdominals, especially your lower abdominals. We need these to stabilize our core, our pelvis, our posture. Our pelvis is really the foundation for everything above and below. So if those aren't working, we are in trouble. We're gonna get pain or injury elsewhere. So this, as you can imagine, causes decreased power generation through the glutes and stability through the abs because they can't work. And then on the opposite side, if you posterior tilt too much, if you overcompensate, then you're almost in this like slouching position in order to get that posterior tilt. So that causes compression of your actual discs in here, in between your vertebrae. Then your glutes and hamstrings are too shortened, and so then you have poor force absorption in that manner, which leads to increased risk of hamstring strains. So hip extension. Hip extension is what you need. I mean, you need this, every single person needs this every single day. If you're walking, if you do any sort of activity, anything, you need hip extension because this is what propels your body forward, or it should be what is propelling your body forward when you're walking by pushing off through your back foot. A lot of times, if you start to notice how you walk or even others walking, you'll notice that people aren't really bringing their hip behind their body or their leg behind their body as much when they're walking. They're more so just using their hip flexors to advance their legs forward. That would be a prime example of them not using their glutes, right? This is a huge muscle, and this part of your glutes, your glute max, is primarily in control of hip extension. Then hip abduction. So the glute med in men, here is the glute med over here. The glute min is kind of underneath it. These primarily still part of the glute complex, but these control hip abduction, which is bringing your leg out to the side, right? But also if you're standing on one leg, your abductor on the standing leg needs to be able to work so that your pelvis doesn't teeter-totter, right? So running, jogging, walking, bouncing to pick something up, whatever your heart desires, any motion where you're even temporarily on one leg, your hip abductors need to work. Your hip rotators, there are a lot of these. You don't need to know all of the names of these things. You just need to know generally where they are. So again, here's your sacrum. This is the back of your body. Here's your glute max, your glute med and glute min, and then also hip rotators. So your glute med and glute min also help with some hip rotation. Their primary motion is abduction, but they also help with some external rotation. Then internal rotators, your inner thigh muscles, parts of your glute med and glute min, and then this TFL here. This guy is a big one. So this is belly button side of the body. This is back of the body. This is your IT band, but your TFL here, if you, on your own body, this is your ASIS. This is that front bony part of your pelvis that you can palpate on yourself. So if you go just below it and then about an inch or two to the right, you should be right on that muscle. Your adductors, again, there are quite a few of them. You don't need to know the difference between them, but they're your inner thigh muscles, okay? They're all generally in the same location. The main thing to note here is that they attach all the way up your pelvis. So all the way up as high as you can get in your groin, and then all the way down, some of them go all the way down to the inside of your knee. So how to assess your pelvic tilt. So how to assess if your pelvis is tilted forward or backwards, or if one side is out of alignment versus the other. What you're going to do is you're going to stand in front of a mirror and you just palpate or find your ASIS bones, right, at the same time. And looking in the mirror, you can probably see here, this one on me is lower than this one. So what that means is that left side of my pelvis is tilted forward too much, which happens with me a lot. So that, do this to yourself. Note if one side of your ASIS is lower than the other, just remember that for now. Another thing to assess your pelvic alignment is you're going to stand sideways in front of a mirror and palpate your ASIS again, and then your PSIS, that little pokey, bony thing in the back, and you're going to see what is the slope here between the two bony prominences. So here is mine. So this is a little bit more sloped here than I would like, right? Ultimately, we would want it to be a little bit more leveled out. It's normal to have a tiny bit of anterior pelvic tilt, and that's actually what we need, but it's when we get to like the excessive ranges that we're in trouble. So again, do both of those to yourself. I'll give you a second there, and just make note of kind of where your pelvis lies. And then before we start with any releases or anything, you always want to check your pelvic alignment before you do releases, because that's going to help you know which side you should primarily do or which side you should start with, especially if you're crunched on time. But then you also want to recheck it after you do your releases to see what the effect of your releases was. Let me see, I think we have some questions up here. Let me look at this chat. So ASIS is the front part of, bony part of your pelvis. So, I mean, if you push anywhere in your abdomen, there's no bone. And then it's just the most prominent part of the front of your pelvis. And so the forward tilt, how will the forward tilt impact the glute activation? The forward tilt affects the glute activation. Let me go back here. So let me pull this chat over here. So if your pelvis is tilted forward on this left side, this image here, then your glutes are pulled into a longer position. And when they're too long, it's essentially, the best analogy I can think of is like a stretched out rubber band that has no elasticity left. It's not going to be able to contract. It's just kind of there, right? So it can't really do much or absorb any force because it's too lengthened. Okay. Let's move on here. Okay, so next is now what? Mobilize, stabilize, and then strengthen. So the goal is to regain your mobility through releases and manual joint mobilization. And note that I'm saying mobilize, but I'm not saying increase your flexibility or, you know, anything pertaining to flexibility necessarily, because everybody's flexibility is a little bit different. What we want is we want to restore normal motion. We don't want to over crank anything. We don't want to over lengthen anything. And again, unless somebody like me, your healthcare provider, tells you to do so. Because really that just causes other problems, right? Normalized mobility leads to more neutral bony alignment because your bones can fall back into place if all of your muscles are at their normal mobility length, which then therefore improves the length tension relationship of all of the other muscles. So all of the muscles that previously couldn't work, like your glutes and your abdominals in that anterior pelvic tilt position, all of those muscles that couldn't work are now invited to the party, right? So they can now work. So before, if you've been a patient of ours in React, and you've felt the difference between how your leg is able to stabilize in a lifted position pre and post hip flexor release, that is a perfect example of this, right? So before, when you lift your leg up and we push down, not able to stabilize very well, right? And then we release your hip flexor and then we retest and you're able to hold it. That is because your hip flexor is now released. So your pelvis can actually roll back into its neutral position. And then all of the other muscles like your abdominals, your glutes, your adductors, they can actually start to work now because they're in a length where they're allowed to. So you feel stronger. You didn't just magically gain strength, but all of your muscles can actually work. That's what we want all of the time. We want all of your muscles to be able to work. So I just liked this little meme. I thought it was funny. Okay, so now getting into a little bit more of the demo stuff. So the main tenets of soft tissue releases, we want to start proximal to distal. Proximal means more from the foundation or the center, or if you would like prefer the example, top to bottom instead, or closer to midline, further from midline being your core. That is primarily what we want to do. So if we're talking about the quad muscle, quad starts up at your ASIS, then it attaches down to your knee. So we would start up higher and then we'd work our way down. So top to bottom, right? If we're talking about your glute muscles, those muscles kind of go and run in an oblique fashion. So there's not a huge top to bottom difference there because they're all kind of in the same area. So for those, we'd use the rule closer to midline, further from midline. So closer to midline means starting closer to the midline of your body, so closer to your spine, and then working your way out, right? And then we would also follow the premise of front to back. So we would want to complete all releases on the front structures of your body, so hip flexors, quads, etc., and then work your way to the back, right? We don't want to go front, side, back, side, you know, just do all the front because that's going to affect the length tension of the back muscles. Then we'll do all of the back. And then for how long, this is a very common question I get. There's no magic number here. When you're releasing a muscle, as long as you feel that good ache or that good hurt, that means you're in the right spot. If you are trying to find that good hurt and you can't quite find it, just keep kind of finagling your position a little bit until you do, because that's a very important part. But otherwise, there's no amount of time. I usually just tell people, stay in that one spot and continue releasing until the pain starts to decrease, because that's your sign, your indication that the muscle is actually starting to release a little bit. If your muscle is very tight, the pain likely will not completely go away until you stay consistent with this for a few weeks. But you don't have to stay in the same spot for forever. But also, if you don't stay there very long at all, if you stay there for like 5 seconds, it's not going to be very effective. So to start with some active releases, so it's very important to do these releases in this order. So this is incorporating a lot of what we just talked about previously in regards to the main tenets. So we're starting at the front of the body, your hip flexors, TFL, quads, and then we're gonna work our way towards the back with the glute QL. All of these videos are demonstrated on YouTube, on React's YouTube site. So I'm not gonna go through all of these, and a lot of you probably already know some of these, but I would like to go through the adductor and the glute because there are some different positions for those. So we'll finish this presentation first and then we'll get there. So again, after you do your releases, that would be when you mobilize your bones, right? So you would reassess your pelvic alignment as we discussed, and then note if anything has changed after your releases. If your pelvic alignment looks neutral, then you're finished and you can move on. If one side is still lower than the other, then you would proceed with this mobilization. The goal of mobilizations is not for you to aggressively push your bone into a different position because your muscles should already be released. The goal is just to utilize your hands and utilize your pressure to block your bones from moving into a position in which you don't want them to, right? So we'll go through some of these as well. Let's go back to this and then I'll go to here. All right. So for the adductor, if you grab a foam roller here, again, your adductor starts all the way up in your groin, goes down to your knee. If you lay with the foam roller as high up as you can get it here, and then you're just gonna straighten and bend your knee. So notice my pelvis on the top is kind of shifted forward. That's okay, because the goal is you need to get pressure through this inner thigh muscle. And then after that part starts to decrease a little bit in soreness, you're gonna roll the foam roller down a little bit on your leg. And then one of the most important parts here is, yes, you want to get, you know, just this flat plane where my foot is flying parallel to the floor. You're gonna get this flat plane to get your inner thigh muscle, but then you also want to rotate your foot up towards the ceiling a little bit, because there are more parts of your inner thigh muscles in this plane. So now my foot is not flying parallel to the ground, but my foot is tilted up towards the ceiling. So this is how you start, flat, and then you internally rotate your hip and you stay here. And notice I'm not rolling back and forth, no rolling pin motions, right? You're staying in one sore spot, starting up as high as you can, top to bottom, and you're activating the muscle in the motion that it actually performs in real life. And then when the pain starts to decrease, move the foam roller down a little bit, find a new sore spot, same motion. The motion is key. Okay, and then glutes. So I like to perform the glute releases a little bit differently than others, but the main thing is you can do it on the wall or you can do it on the floor. I like doing it on the floor because then you can really push more weight into the actual glute muscle. Lacrosse ball. So you're going to start up at the top at that glute med. Hopefully you can see this. Here's the ball here, right under your glute. You can leave your foot on the ground. Then I'm shifting my weight over on top of the ball so that I'm really getting a lot of force down into the ball there. Then I'm just gonna drop my knee out to the side and back in. And again, you're gonna do this until the pain starts to decrease. And then you're just gonna move the ball slightly out to the side, because the glutes do not go up and down, they run at an oblique angle. If you don't feel much with this, cross your ankle over your other knee, and then toggle your knee side to side. Then for your glute max, same thing, same motions. You just lower the ball a little bit. You can look back at those anatomy charts and see where that muscle is located to see if you're getting it, right? And then also with your hip rotators, it's a little bit lower, basically just above your sit bone. So closer to your head from your sit bone, and then out to the side a little bit. And these might be a little bit of a different type of sore sensation than some of the other ones. But as long as you're getting a sore sensation, then you're likely doing them correctly. All right. So half kneeling hip flexor stretch. So for this one, there are mainly some things here that I want to point out to not do. So first, the goal is you want this knee to always stay over your ankle. We don't want your knee forward, because this means now you're overextending in your low back. This is going to cause more low back tenderness and soreness. We don't want that, right? Knee over ankle. Hands on your hips to make sure your hips are staying level. And then just squeeze your glutes to kind of push your pelvis forward ever so slightly. Not a lot, but just a little bit, right? So this is version number 1. Now, version number 2 is you can reach over towards the side of your front leg. Because what this is doing is it's stretching out your hip flexor and your low back muscle on the elongated side. And again, you're not bringing your knee forward, right? Keeping your pelvis level. And then the last version, this is kind of the most extreme version, is you can lift up your back knee, grab your foot to get a little bit more quad stretch. That one just hurts right now because I'm on a hard ground, so I'm not going to do it. All right, hip mobilizations. I think you can see some of the pictures here. I don't have anything to anchor this band here at home, but you're essentially doing the same position as that hip flexor stretch to start. And with the band, it's really just mainly important that you keep the band up in your groin as high as you possibly can, because we want the band to be your force applied as close to the joint line as possible, right? And again, as you're pulling forward and backward and pulsing, you're not overextending your back. Let's see, we have a question. Okay, Piriformis Stretch. So this one, so this is version number 1. I do not have my feet on the wall, but crossing one ankle over the other, grab behind that thigh, make sure your pelvis stays level on both sides. You're not like hiking one side up just to get there. If you are, then lower your feet down. Pelvis needs to stay level. So pull your leg up here, and then you're just gonna do small little motions side to side. The rest of my legs, like the lower part of my legs and everything, are relatively relaxed here. You don't really need to tense anything up. You don't need to lift your head off the ground. You just want to kind of work into this motion while keeping everything else relaxed. Second version, if you don't feel a ton with that, or if that's not enough, scoot closer to the wall. Same position, and then while holding this, again, keeping your pelvis level, you'll push your right thigh away from you, holding that, and then you're gonna try to lengthen your tailbone towards the wall while keeping your low back flat. By lengthening your tailbone, the goal is not to arch your back, but just to lengthen your spine. Then last progression of this, off of the wall, is add a little bit of pelvic and lumbar rotation. So drop your legs just as they are in that figure 4 to the side. Hold onto your foot with your one hand, other hand, again, push your thigh bone away. You're not gonna feel a lot in your low back with this, and that's not the goal. So that's fine. But this is just elongating some of those fascial structures and getting you the force as close to your hip joint as possible where you need it. Okay, these are controlled articular rotations. Articular means your joint. So if you're in a quadruped position here, just like Bart was doing, you just lift your leg straight up towards the ceiling, keeping your back as flat as possible. Externally rotate your leg, and then you bring it back down. And slowly, right? So my elbows aren't bending, I'm not shifting side to side, just lifting up, nice and controlled, out to the side, and then back forward. Then you can go the other direction and repeat. 10 to 15 times each direction. You can switch sides in between. And then all of these are on our YouTube page too, right? So don't be afraid to go look them up. I tried to put the typing and the name of the release or the mobilization in this presentation exactly as it is on the YouTube, so you should have no problem finding it. But let's go to that pelvic mobilization now. So if you haven't practiced this yet, so the goal here is webbing of your hand. You hook it into your hip crease, because now your ASIS, that bony prominence, is going to be pushing into the palm of your hand. And you're just going to do little lunges forward and back. Nothing big. But the goal here is that your hand is blocking your pelvis from rotating forward, because that bony prominence can't rotate forward because your hand is there. This is called a mulligan mobilization with movement. It's created by a very old little man from New Zealand, Brian Mulligan, and he's just has the tiniest little hands, so you definitely do not need to apply a lot of force here. He actually preaches minimal force, because the goal, again, is not to aggressively mobilize your bone, but just to hold your bones into their neutral position, and then allowing your muscles to work as they should to kind of reposition it. So to review, first, look at your pelvic alignment. Then you want to do your soft tissue releases. Then you want to relook at your pelvic alignment, reassess. Then if it's still out of alignment, use that mobilization that we just did. And then you can strengthen, do whatever else you choose. These are all good to do. You can do these as many times a day as you want. All good to do, especially before exercise, because you want everything to work, right? Everything wants to come to the party, especially now because we're all bored. All right, let me move this. I think that's all we have for now. Yes, and then we will send this out, slides as well. If you have any questions, please shoot me an email. Otherwise, it was nice chatting with everybody. I'll unmute everybody in case anybody has anything to say. All right. All right, bye everyone.